Hello, I'm Laura Siminoff, Dean of the Temple University College of Public Health, and joining me are our faculty experts, Graciela, Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy. Now, as the United States slowly eases the restrictions that we have all been living with to defeat the virus, we thought it might be interesting to consider the experiences of other countries who have already started the process of reopening. So, first, let's talk about Hong Kong, which was cited as an early success story in controlling the virus. So Sarah, what's happened since it started to reopen in Hong Kong?
So I think the interesting thing about Hong Kong is that unlike a lot of the countries that we're going to talk about today, a lot of the success in Hong Kong has really been driven by the people of Hong Kong rather than the government. So Hong Kong has about 7 million people, and in many ways it's essentially stopped COVID-19 without a lot of the shutdowns that we've seen in other countries, including ours. And they really should have been very hard hit, right? So it's a very dense city, one of the densest in the world. It has a lot of cross-border traffic with China, and it's also very crowded. So trains, public spaces, etc. It even is connected to Wuhan, China, with a high-speed train line. But they have, their peak has only been 64 cases a day, which was at the end of March, for a total of just over 1,000 cases in the whole city.
Wow.
And they've only had 4 deaths in 5 months. And the interesting thing is that they have kind of a very weak decentralized government reaction, and they never really closed borders with China. And at the beginning, they banned mask wearing. So the reason that this happened really was achieved by the people instead of the government. So they, because they had the large social movements and demonstrations in 2019, they really had organized a capacity and kind of civic infrastructure that was built by these grassroots. And they had done things like build websites and social media that they used. And so what they did was they adapted these to COVID. So they did everything from track COVID cases, they monitor hotspots, they reported hospital wait times, they provided prevention information, and the public really adopted kind of universal mask wearing despite the government banning it at the beginning. They even created what they called a mask brigade that made and distributed masks to the poor and the elderly. And they had this army of volunteers who went into crowded tenement buildings and other buildings to install hand sanitizers or dispensers. When the government refused to close the border, they had more than 7,000 medical workers who went out on strike. And the public kind of responded by wearing white ribbons to show support, and they did street art and demonstrated hand washing. So they did just, I mean, all the things that you would think that a government should do. And they did it themselves. So I do have a couple of pictures that I think are really interesting. So this is an example of the mask brigade. So they gave out all these homemade kits to show people how to make masks. This was one of the volunteer groups that they were taking things out into the tenement buildings. This was the strike of healthcare workers. This was one of the tenement buildings, so going through and monitoring. They even went in and they did disinfecting in what they call these coffin rooms, which is, you know, very close quarters that families live in. And this is an example of some of the social media output that they did. So really the interesting thing about this is that they kind of had this unprecedented public response that we haven't really seen in other countries, which really shows this kind of power of crisis communication.
Do you think some of that may have been driven by the fact that they had the SARS outbreak?
I think a lot of it has, so they, you know, remember that,
Right.
and they kind of took it over quickly because of their previous experience.
Now, did people stay at home voluntarily? What did they do?
Interestingly, it was fairly open in that restaurants never closed. They did close schools, but other things were not really closed. So you'll see pictures of kind of makeshift things in restaurants, let's say, that, you know, separates one table from another, but none of it was government driven.
Wow, that's really amazing, isn't it?
Mm-hmm.
So let's look at an experience of a country that's a little closer to home. So Heather, who's actually from Canada, is going to tell us about the Canadian experience. And it's quite a bit different from ours, even though in many respects we're pretty similar. So Heather, tell us a little bit about what's gone on in Canada and why their experience seems to be quite different from ours.
Yeah, Laura, it's pretty interesting talking to my family back home, understanding different perspective. And I have a friend who works for the Ontario Public Health, the provincial public health group in the province of Ontario. And then my family lives in Nova Scotia, which is a very small province. And what they described to me is quite a bit different than what we see in the US. But to put us in context, I wanted to show just a bit of the figures and what we're looking at compared to the two countries. So in Canada, the majority of the cases are concentrated in Quebec and Ontario. That's where we see the highest amounts of cases. And in contrast to the US, they've shut the borders between the provinces. So it's very difficult to move between provinces to actually isolate it. You need special permission to get in and out of Quebec, and it's basically only essential workers and truck drivers and things like that. If we look kind of at our curves, you could say Canada is kind of coming down a bit, but I would say Canada's maybe still not fully flattened, let's say, although they are starting to phase into a bit more of an opening up. What is different a little bit is the testing rates. Canada started on a higher trajectory of testing rates. So these are testing rates per 100,000 people for all of the provinces across Canada. And then for reference, I put where we are in Pennsylvania and where we are US wide and where New York State is. So New York is off the charts in terms of their testing. US wide, in the provinces where they have the highest cases in Ontario and Quebec, and actually my parents' province, Nova Scotia, they're doing a lot of testing and with rapid turnaround. And overall, we're in Canada is being testing has kind of always been ahead of the game. So this is another curve showing essentially the same things. So in Canada right now, their capacity is to test around 1.6 tests per 100,000 people per day. And in the US, we're only at 1. So they're 1.5 times what we're able to do here. Some other interesting things I think that make the response different in Canada and the US is really there was a unified federal response from the federal government. And so the federal government, because of the public health care system, is actually an agent for securing PPE and supporting all of the provinces. So they've taken funds that are at a federal level and then redistributed to the provinces that need them the most, which is very different than what we see here in the States, where kind of every state is fighting for themselves, essentially. There's been, the shutdowns happened a bit earlier in Canada in some provinces. That was another key difference. The public health budget in Canada has been increasing in recent times, whereas public health and the CDC's budget has been cut by 10% in the last decade in the US. So big difference isn't just the way the public health preparedness was available and prepositioning of ventilators and things. And Canada was hit pretty hard with the SARS outbreak years ago. So particularly Toronto, people were ready. And when they knew that there was a coronavirus outbreak in China, I think everyone thought it's going to come here. It's just a matter of time. And then in terms of opening up, some of the differences, and I think Laura, you talked about it before, once is this bubble, this two-family bubble. So they're experimenting with opening up the social distancing by allowing families to pair up with another family and kind of essentially isolate together. You can pick another family, you can just pick another household or group of friends, but as long as you're committed to not letting anyone else in your bubble, then that is being allowed in some provinces. The province of Ontario today is restricting quite a few of their restrictions on allowing people inside the homes, housekeepers, nannies, things like that. But a lot of them are still restricting gatherings to below 5 people, sometimes no gatherings at all, indoors at all, moving gatherings outside, but still limiting to them below 10 to 15 people. And then they're opening up park trails and things. So I think there's then some similarities between the US and Canada, but nothing about really restaurants and things like that opening up.
Right, so it's a much more gradual, graded approach. And so does each province have slightly different approaches, or everybody's pretty uniform?
They are slightly different. I'd say they're less different than we see the differences in the US. But every province has kind of got their own variation on what's going on. And some of them are a lot more strict than others. Some are talking about opening up schools, whereas some provinces said, no way, we're not opening up schools this year. Some are voluntarily opening up schools so people can choose to send their kid or not. So that's happening in June in some provinces. I know my parents' province of Nova Scotia, although they have very, very few cases, they're not really opening up very much because I think they recognize their healthcare system is maybe a bit more fragile. They have a lot of elderly people with a lot of underlying health conditions, and the premier just doesn't want to risk it. So they're keeping things still pretty locked down, I would say.
That's interesting. We'll see what happens then.
Yeah, it's still early, I think, in their opening up. So we'll see how that evolves in the coming weeks.
So the next example we wanted to talk about was Spain. And Graciela, who has a sister who lives there, is going to talk about Spain. So this is a country that had one of the earliest and worst outbreaks of the virus in Europe. And I know they've started reopening. And I wonder how they're approaching that and what you think is going on there. Are they opening up too early? Too much, too fast? What do you think, Graciela?
Well, if we think we have it hard in this country, I really pity my sister sometimes. So Spain recorded the first COVID-19 case on February 26, and by March 13, with 120 deaths, the President Pedro Sanchez declared the state of emergency and put in place very, very strict stay-at-home orders. They closed schools and businesses, and they limited people's movements from city to city. People had to carry, in fact, an official permit to go out of their homes, without which they were fined up to $1,500. So you really could not get out of your house. So Spain managed to slow down the cases of COVID-19 towards the end of April, and the stay-at-home orders were slightly relaxed. So children 14 years and younger could go out for 1 hour accompanied with an adult each day, and people could leave their homes for a walk or a short run. So now I've been going out with my husband every day from the beginning of COVID-19. They couldn't even get out of their houses. They could get out to, if they had a balcony, to the balcony, and that was it. So on May 4th, Spain began reopening regionally following 4 graduated phases. The requirements to reopen a region were very strict, well, are very strict, and include reaching a reproductive number less than 1, meaning that a case infects less than 1 other person. Testing and isolating all cases and their contacts, tripling the number of ICU beds that they currently have, and maintaining community-wide protective measures. So in phase 0, so some small businesses such as hairdressers, hardware stores, or bookstores reopen, limiting the amount of customers via appointments. So my sister was saying, you can only have 1 person in the supermarket, for instance. So you would have to stand in line for 4 hours to just get into the supermarket. Wow. So it was very strict. People also in phase 0 started being able to purchase takeout food. Up until then, they couldn't get out other than the supermarket or going to the healthcare, the hospital or healthcare services. So churches also were open, but at 30% capacity for the congregants. During the first phase, which is projected to be as early as May 25th, people will be able to have social gatherings of up to 10 people, and bars and restaurants will be able to open at 50% capacity. At this point, about 70% of the regions in Spain are in phase 1. They hope that by the end of July, June, they'll be in a better place. So the second phase, is as early as June 8th, will allow larger gatherings of up to 15. Bars and restaurants will open at 30% capacity, and other businesses will open at 40% capacity. So this reopening is very gradual, very much like in Canada. Beaches and movie theaters will open also at 30% capacity, and additionally, people will be able to start moving between regions as long as the travel destination is also in this second phase. So now people cannot go from one city to another. And in the last phase, the restrictions are further relaxed, and they are moving towards what is called the new normal. And this new normal is projected to begin June 22nd. People will be able to behave as before the restrictions, though businesses will only operate at 50% capacity, and people will still be required to practice 6 feet distancing, use masks, and wash hands frequently. So what I can say in summary is that Spain has a well-planned reopening, but also if COVID-19 returns, they are also well-positioned to return to stricter protective measures.
That sounds really good. It sounds like they're very organized.
It's very organized. It's very gradual. They are being very careful, but they are ready to go back to zero, really.
Right.
And
this is hard for a country like Spain. They really, really rely on tourism, right?
Yeah. So, I mean, it's very, like Spain is a very, I mean, in Spain, people go out all the time. They're in contact with people, they hug, they shake hands. And it was very, very hard to stay away from people and isolate as strictly as they did so far.
So our last example is in some ways the example that looks most like ourselves in certain ways, the United Kingdom. So Krys is going to talk about the United Kingdom. So they're interesting because they seem to have gone through a number of kind of behavioral phases, including an initial thought that the virus wasn't such a big deal, then an attempt to sort of create herd immunity, and then going to a pretty serious lockdown. So Krys, can you first talk about why this notion of herd immunity isn't working, and then talk about what's happening there now?
Sure. So herd immunity is just increasing the number of people who are in the population who are immune to the disease. And for most diseases, this is between 70 and 90%. So that seemed to be the UK's modus operandi, what they were planning to do for a while there, until the Imperial College of London released a study that found that about 500,000 people in the UK would die using this method. So pretty quickly after that study came out, we started seeing businesses shutting down, and that was about the same time we saw things shutting down in Philadelphia, the middle of March. Mm-hmm. But there weren't any state mandated closings until a week later on March 20th. And that week of allowing social distancing can allow hundreds of thousands of people to remain in contact and become infected over that time frame. Ironically, just a week after the Prime Minister closed the country and enforced stay-at-home orders, the Prime Minister announced that he had become ill with the coronavirus and actually was pretty severely ill. At points was unable to perform the duties of his office because of it. And I think that that is really a hallmark for how bad it was in the UK during that time because of this lack of systematic closure. And I've seen some statements from the leadership in the UK that said that that closure was delayed because they didn't want people to have quote unquote behavioral fatigue. So kind of what we're seeing now where people aren't wearing their masks as much, they're not social distancing as much. They wanted to kind of postpone it as much as possible, which, you know, it might make sense except for the fact you realize that you're actually infecting more people that way. And even to this date, the rate of deaths in the UK is 1.3 times the rate in the United States, and they have national health care. So everyone there has access to healthcare, and their healthcare is very easily being overwhelmed because of the number of people who were initially infected.
And what about their ability to test? They seem to have some of the same troubles that we do.
They do, and they seem to finally be getting closer to being able to test people. But as recently as April the 2nd, there's one of the science advisors to the administration said that mass testing has never been part of our strategy of addressing this pandemic, which just kind of steals an epidemiologist. So they have released a national health system contact tracing app. It is only in piloting stages, so we're only about 2 weeks into that. We'll see how that works. But as of yesterday, they finally made testing available to everyone age 5 and over in England, Scotland, Wales, and Northern Ireland. So anyone in the UK over the age of 5, they now say can get a test.
Okay. So where are they on their trajectories? Are their cases still going up? Are they plateauing? I know they're not coming down yet.
So they still, they say that they have flattened their curve, but it seems to be more of a plateau than a true flattening. And I think that as we see what comes out of this new availability of testing, we'll have a much better idea of where they are in the curve. Notably, they do now require the 14-day quarantine of anyone coming into the country. So it really does seem like they have gotten the steps in order to address this, and they might be coming out on the other side, hopefully.
Well, I hope so too. So I think that's it for today. I think it was really interesting to hear about the very, very different experiences across countries, and hopefully there are things that we could learn from all of those experiences. So thanks for joining us today. Remember that even as some of the areas of our country are opening up, we still need to stay 6 feet away from people we don't live with, wear a mask, and keep washing our hands. Here's last week's panel. View other videos and find links to reliable information. Please visit cph.temple.edu/coronavirus. Thanks.